Smart Care. Sustainable health for the future.
We're here in Stockholm to see how a seemingly simple change in the way that doctors communicate has slashed waiting times for Parkinson's disease patients from 6 months down to just 7 days. And it's a change which is all about putting to one side the old ways of working, like pens and papers, and moving to new technologies like video links instead.
The pioneers of the project are two neurologists, Anders Johansson and Christian Karlstrom. They began holding weekly video conferences to discuss whether Christian's Parkinson's disease patients needed advanced treatment or not.
How much time are you saving with this project?
So it takes me 15 minutes instead of 1 or 2 hours if the patient would have been referred here, and I would have to search for extra information and follow up with telephone calls or so.
Before we had no contact either by eye or ear. I wrote a letter to him, which is not a very good way to communicate, and it takes a lot of more time.
Switching to video links rather than letters has not only cut waiting times to see a specialist, but also reduced unnecessary referrals, according to a review by the Karolinska Institute. We met two leading patient representatives to get their views.
Elena, tell me, what is the real situation on the ground for Parkinson's disease patients in terms of waiting times?
Yes, there are long waiting times, from 6 months up to 1 year, 2 years maybe of waiting time.
Inga, tell me, what are your thoughts on this project? What do you think it means for patients?
The fact that they're working together in this way does make it much more efficient. There's always a danger when two neurologists talk together that it happens over the head of the person who has Parkinson's. And it's very important that the one who has Parkinson's must be involved from the very beginning. And this is a small risk.
Healthcare systems in general are slow to embrace digital innovations. One of the reasons lies with administrations, according to Stockholm County Council's e-health expert Daniel Forsland.
If the hospital or the health clinic is not reimbursed for a digital meeting or a virtual meeting, then they will only, naturally provide the old ways of interacting with a physical meeting. So we have to make our regulations more flexible and open so that health professionals can try what's best actually for the patient.
Many voices agree that this new approach does have potential, but for the moment it remains at a very small scale. So how would the doctors like to see things develop in the future?
Dr. Karlstrom believes it would be worthwhile to try this video link technology with patients too.
It worked like this, that the patient has a camera and a video equipment at home, and they could just be online for 2 or 3 times a day, 5 minutes each or something, and I could ask the patient, how is it? Can you show me the movements? Is it better now?
Seeing how you're working together, you have to ask, why weren't you doing this before?
That's a very good question. I don't know. It's so obvious and easy, so it's just better than the way things were before.
The project in Stockholm has now been extended to 5 other neurologists in other parts of Sweden.
Smart Care, in partnership with AbbVie.